It is said that a system that takes from Peter to pay Paul will always have the support of Paul. It appears that we have a room full predominantly of Pauls tonight. Let me ask you this. If I were to steal money from you, and I was caught by the police and brought before court, and the judge asked me, you plead guilty or not guilty? And I said, not guilty. He said, why? And I said, because I took the money and I paid my medical bills with it. What would you expect the judge to do? Would you expect him to bang down the gavel and say, case dismissed? Or would you expect him to say, I don't care what you did with the money. It wasn't yours to take. Now imagine another scenario. The government takes your money. That seems to be acceptable to most of the people in this room. And yet the two scenarios are morally equivalent. They are both wrong, immoral, and evil. They are a violation of your rights. Your right to keep the fruits of your labor. The right to keep your property. What you have earned from the sweat of your brow. The idea behind socialized medicine is that one person's perceived need is an automatic claim, translates into an automatic claim on another person's income, and assets, and property. I don't know how you rationalize that. To me, it's totally irrational, and it's immoral. The idea came up about the general welfare. It's mentioned 2 times in the Constitution. Once in the preamble, where it says that we, the general welfare, ordain and establish this Constitution for the United States of America. Stand back and ask yourself, what is the purpose of the Constitution? The purpose of the Constitution is to limit the power of the federal government. That means that general welfare is best served by keeping the federal government as small and constrained as possible so that the people are the most free as they can be, that their rights are protected. This discussion tonight basically is about what is the role of government. And even step back from there and ask yourself, what is government? And I think George Washington said it best when he said, government is not eloquence, it is not reason, it is force. Like fire, it is a dangerous servant and a fearful master. The Founding Fathers understood this very well. And so they gave government a monopoly on the use of force in order to secure our rights to life, liberty, property, and the pursuit of happiness. I'm surprised nobody mentioned sicko tonight. My buddy from Texas was here last month. He was my guest, and he suggested I watch Sicko and comment on it here tonight. Michael Moore, that Tinseltown Leninist, went around to various countries, and he even managed to find a hospital in Cuba that looked like a 5-star hotel. Talk about a setup. The New York Times said, as always, Michael Moore exaggerates, overly generalizes, ignores opposing viewpoints, and raises doubts about how much he should be believed. He talks about Canada, Canadian healthcare. Somehow he could not find any of the nearly 800,000 Canadians who are not so lucky as to have prompt healthcare, according to the Fraser Institute, which does a yearly analysis of the wait times in Canadian healthcare. If Canada had the same population as the United States, that would mean almost 7.5 million people would be on a waiting list. I want to make just one more quick comment. It's worth noting that medical procedures not covered by health insurance, such as cosmetic surgery and vision correction surgery, have experienced both increasing demand and falling prices and increasing quality. Why? In a word, competition. And therein lies the answer to improving healthcare in America. More freedom for doctors and patients, less government interference, and more competition. Thank you.
Now, James Simmons, well, 5 minutes to the podium.
I had the feeling tonight's debate topic was something other than what I thought it would be. It was at such a high level of abstraction, I hardly knew it was about healthcare. I will tell you, if you wanted a single-payer system, you could go to Iraq and Afghanistan. They have a single-payer system, everyone is covered, and you, the taxpayer, are the single payer. Japan is actually below Great Britain in terms of the share of GDP that goes to the cost of healthcare. There must be a lot of people sitting in waiting rooms in this country shooting the bull in the way they do in Japan. This is a room full of Pauls. I suggest to you this is a country of Pauls. Because I want to cite some recent polls. New York Times, CBS, 54% of respondents said fundamental changes are needed in the healthcare system. 57% were dissatisfied with the healthcare. 81% dissatisfied with the cost. 52% dissatisfied with the cost of their own healthcare. 65% providing for the uninsured was more important than keeping costs down. 95% said that health insurance was a serious problem. Go on to Washington Post ABC. 62% of respondents preferred a universal health insurance system in which everybody is covered under a program like Medicare that's run by the government and financed by taxpayers. Only 32% preferred the current system. 56% would support a universal health insurance program even if it limited their choices of doctors, and 63% would support it even if it meant they were willing to wait for lists of non-emergency treatments. Like most democracies, the meaning of the general welfare, the pursuit of happiness, is determined by majorities of the public. Unfortunately, when these issues come up, you have commercials run by the fearful master, which is insurance companies, actually. I prefer to put my life in the hands of the federal government rather than insurance underwriters under any circumstance. The fact is that the justification, both moral, practical, and financial, for a single-payer system is undeniable. It's overwhelming. It's popular. It's consistent with the Constitution, except the most narrow libertarian version of that. We could argue that in some other debate. I'd enjoy it. But the fact is that tonight's debate is about single-payer system, which you've defined as a form of socialized medicine. We need it. We want it. The thing preventing it is a lack of political will. The thing preventing it is interest groups representing those who currently benefit from the current system, who run the Harry and Louise ads. We even have a lack of political will in the candidates of both political parties. Is it going to happen? I think with more anecdotal stories by people experiencing the problems with the current system, those people working real hard who aren't covered, or if they are, it's because they've got a wife or husband employed by the university or someone with a health insurance system. The more of these stories, the more Pauls, and the more likely a single-payer system is going to come.